Hello, everybody. Great to have you all on the call. My name is Michael Hornberger, and I'm the Professor of Dementia Research at the University of East Anglia. My great pleasure today to have you with us, and we have Julieta Camino talking about what care and management style should I use to support people with dementia in daily tasks. Before we start with the talk, just a quick housekeeping. Please keep your microphone switched off during the talk, and please keep your video switched off during the talk. It's really just to avoid people having interruptions in the talk. I can see, sorry, is it Sue Vaughan? Could you switch off your microphone, please? Let us know if you have problems with that. It should be, there you go, fantastic. Thank you very much. So, just to say, we have later a question and answer session, so you can take part in that. There are three options really how you can send questions to Julieta. One is you just click on the chat in your meeting control toolbar, and this will open like a chat box, and you can just type in your question in that chat. And we go at the end, we go through the chat and ask all the questions. But if you prefer to ask your question in person, we ask you to switch on your video, but keep your microphone off. And then when I see you on the video on, I will ask you to switch on your microphone. You can ask your question in person. And finally, if your question was not answered or you want more information, you can also email us at dementia.research@uea.ac.uk. Don't worry if you can't note that down. We will put at the end of the talk, Sam will put this again in the chat, the email address, so you can get in touch with us. So without further ado, I will hand over to Julieta. And yeah, it's my great pleasure. So Julieta is a third-year PhD student, is that correct?
Yeah.
Oh, I got that correct. Excellent. So, she's talked previously already about her work on the carers, and today is really an extension of that work. So I'm very excited to have her here. So over to you, Julieta.
Thank you very much. I'm going to share my screen with all of you. And I said before that I am going to turn off my camera because it makes me feel very anxious to see me there around. So let me do this first. Yes, share. Can you see it now?
Yes, I can see it.
Lovely, excellent. So I'm going to turn off the camera and I'm going to start. Okay, thank you very much, everybody, for being here, for having me today again. As Michael said, I gave a presentation last year at this forum, but I'm really happy to be here again and sharing another study. I am working at the School of Health Sciences in my PhD at UEA, and my supervisors are Professor Miyoshi and Dr. Kishida. And today I'm going to present one study which is part of my PhD. And for those who didn't hear me last time, my PhD is looking at the role of external factors in people with dementia's performance of daily tasks, because I want to understand if they can explain why some people with dementia present with the ability to perform tasks when they don't actually perform them daily. And you can see here, this is an overview of my thesis. This is what it looks like, at least in my mind at the moment. It still hasn't been written, but we are going there. And last time I talked to you about the role of the environment in the performance of daily tasks. And today I'm going to talk about the role of the carer. But in particular, I want to talk to you about how the style that carers use when dealing with dementia-related problems might affect the performance of daily tasks. And as part of my PhD, I'm also investigating the discrepancy between the carers report of people with dementia's performance of daily tasks and their actual ability to perform them. And one chapter is dedicated to the investigation of the assistance given by carers during the performance of daily tasks. And this is just to give you an overall idea of how I am addressing all these factors and why I'm going to talk to you about the care style today. But before we continue with the presentation, I want to briefly mention that I'm going to use different terms to refer to people with dementia's performance of daily tasks. So to avoid being very repetitive, I'm going to talk about activities of daily living, or their acronym ADLs. So when I talk about ADLs, I'm talking about activities of daily living, task performance, daily tasks, everyday functioning, and ADL performance. I am referring to the performance of any activity, very simple, such as washing hands, eating, getting dressed, or more complex tasks such as driving, cooking, or doing the shopping. So when I refer to the performance of daily tasks, I'm talking in general about any of these particular tasks. But let's focus on today's presentation. It's about the role of the care management style. Yes, I want to explore if the care management style have any effect on the performance of daily tasks in people with dementia. So if there are carers in the audience, I would really like to discuss with you the study, the results at the end of the presentation. So please bear in me, because I would really like to hear your thoughts about this. So it is really well known that people with dementia present with gradual deterioration in the performance of ADLs. This is not new, and this is actually a diagnostic criteria in dementia. So the person has to have a problem in their daily routine in order to be having a diagnosis of any dementia disease. And several intrinsic dementia factors or symptoms caused by dementia have been associated with this impairment. So over the past decades, cognition and behavioral changes have been the main two dementia symptoms that have been studied, and both are really the most common ones. But talking about cognition, so what happened was that specific cognitive functions were found to be associated with problems in specific ADLs, and other studies have been using measures of global cognition, for example, memory, a cognitive screening test or a memory test. Those are the ones that are really used in memory clinics, for example, but they shown contradictory results. So some have shown relationships between cognition and ADL performance, while others found no associations between them. So there is still a bit of a controversial there, even though we know that the cognition affects ADL performance. But if we move on to behavioral changes, apathy, which is the most common behavioral symptom reported in dementia, have shown to have a negatively effect in the way the person with dementia performs ADL. This is really well known and has been reported over the last couple of years. However, if we think about these two dementia intrinsic factors, they do not seem to fully explain all the changes that the person with dementia experiences in the performance of daily tasks. So if we look at the literature, not all the problems in ADLs are completely associated with dementia symptoms, which means that there is still a lot to learn about what happens in ADLs in people with dementia. Other factors, such as external factors or the care-related characteristics, have also been associated with the performance of daily tasks. For example, the carer's level of depression or burden have shown to have a negative impact on ADL. So if the carer is depressed or burdened, the person with dementia's problem with ADLs tends to get worse. But today I want to focus on another external factor, which has been given less attention in the research field, which could also affect the way the person with dementia performs ADLs. And this is the style that carers use when managing dementia-related problems. These management styles refer to the specific ways in which a family carer approaches dementia-related issues. And in the literature, 3 different care styles have been described so far, and they are based on the strategies used by carers: criticism style, active management, and encouragement style. I'm going to show you some examples. So we are going to start with criticism. Criticism describes efforts to manage the person with dementia by actions such as yelling, criticizing, threatening, and related behavior. And one strategy included in the criticism style is, for example, I asked my relative to explain why she was doing something, to draw her attention to her mistakes. So this is one strategy that is an example of the criticism style. Active management style, the other style that carers can use, includes actions to assist, engage, stimulate, and associated behaviors that they are primarily directed toward modifying the environment or daily routine of the person with dementia. And one strategy of this style is, for example, this one. I repeated the same things over and over again to make sure my relative got them or understood them. This is the active management style. And the other style is encouragement, which includes efforts to praise the individual, to get them to discuss feelings or look on the bright side of things. And an example of encouragement is, for example, I encouraged my relative to adopt a fighting attitude and to do as much as possible for him or herself. So these are 3 examples of strategies that belong to each of these care styles. The thing is that studies on the care management styles in dementia are really rare, and some have found correlations between the use of the cares, for example, the cares use of criticism that was found to be associated with higher care burden and increased use of home and social services, while the use of encouragement style has been associated with the care's greater feelings of gain, which denotes a positive caring experience. But regarding ADLs, there's a clear gap in the literature of everyday functioning because to date, I couldn't find any evidence on how the use of care management style might affect the performance of daily activities in people with dementia. And if we think further about this, the interaction of cognitive deficit, apathy, and external factors such as these care management styles is less known at the moment. But this is mainly because studies they mainly focused on the investigation of intrinsic or external factors separately. And this, for me, has raised a clear question. I didn't mention before, I think I am an occupational therapist by background, and I have worked with people with dementia and their cares for many years, and they have been asked this question several times in the past. What strategies should I use to support ADLs? That was a really repetitive question with cares. What shall I do? How should I do it? So I think that clarifying the role of care management styles within the context of the person with dementia's level of cognition and apathy, this would inform clinicians, researchers, but mainly carers, family carers who daily help the person with dementia on the usefulness of different care management strategies to support daily function. So I think this is the clear goal of the study so far, is to investigate the contribution of both intrinsic dementia factors and external factors to the person with dementia's performance of ADL. So this is the main goal for today. So participants in this study were originally recruited for the TASK project, which is a study funded by the Alzheimer's Society and is led by Professor Miyoshi, my supervisor. And they recruited more than 180 people with dementia. I say they, but we, because I was part of it as well. But I included in this study 143 people with dementia and their carers if they had a diagnosis of Alzheimer's disease or vascular dementia. They had to be living at home. They had to be older than 40 years old and younger than 90 years old. And the carers, they had to be fluent in English, older than 18 years old, and they had to provide at least 7 hours a week of unpaid support. These were the inclusion criteria for this study. And the instruments that I used, so of course I include demographic questionnaires for both the carer and the person with dementia, but to assess performance of ADLs, I used the DAD, which is the Disability Assessment for Dementia. This is an informant-based interview assessment. This has been widely used in people with Alzheimer's disease and others dementia as well. The DAD includes the assessment of both personal care tasks such as eating, hygiene, and dressing, and instrumental activities such as meal preparation, household chores, and going out, driving, etc. I included the A3 to measure global cognition, which is the Addenbrooke's cognitive examination, third version. This is an internationally well-recognized dementia screening tool that assesses cognitive skills in 5 different domains: language, attention, memory, fluency, and visuospatial abilities. And to measure apathy, I used the apathy subscale of the CBIR, which is the Cambridge Behavioral Inventory revised version. This is a self-complete questionnaire that is completed by the carer to measure changes in behavior in the person with dementia, and includes apathy, sleep, changes in eating behavior, and other behaviors. But as I said, I only included the apathy subscale. Sorry. And for the carers, I used two main questionnaires, the DMSS, which is the Dementia Management Strategies Scale. This is another self-complete questionnaire that identifies and characterizes three different styles of management, the one that I mentioned before: criticism, encouragement, and active management. So the items measure the frequency by which the carer uses each strategy when managing dementia-related problems. So the scale presents different strategies, and the carer has to say, I never use these, or I use it seldomly, or often, sometimes, and most of the time. So it goes from never to most of the time. That's the range of the frequency. And then to measure depression in the carers, I used the PHQ-9, which is the Patient Health Questionnaire. Again, this is another self-complete questionnaire that assesses level of depression. So a quick word about data analysis. I run descriptive statistics to characterize the sample, and I run a regression analysis to investigate the role of different factors in the performance of ADLs. And I'm going to go to the results now. So I'm here summarizing some demographic information. So the first rectangle is about the person with dementia. They were 78 years in average. They were mostly male. They were married, and the majority of them were living with the family. As you can see on the second rectangle, the majority of them were in the severe stages of dementia. And the third rectangle is about the carers. They were younger than the person with dementia. They were mostly females. They were spouses, and they reported mild symptoms of depression. And this is another figure with demographic characterization. So I wanted to know what was the difference between the people in the moderate and the severe stages of dementia in regards to their level of cognition, apathy, and ADLs. And I didn't include the mild stage of dementia in this analysis because the sample was really small. I had only 10 people in the mild stage, so I didn't think it was going to be representative. So I only did it to compare the level of these clinical variables in these stages, and they were all significantly different in the three categories. So this means that the level of cognition was significantly different between moderate and severe stage, and the same for apathy and ADLs, which is something that I was expecting. The next figure, this is a heat map. I'm quite proud of it, I have to say. But here you can see the frequency with which carers reported the use of different strategies. So you have at the bottom the three care styles: criticism, encouragement, and active management. And you can see the range of the frequency that the carers used. And for example, regarding the criticism style, you can see that the majority of our carers rarely used strategies belonging to criticism. And our carers reported using an active management style more often than the encouragement style. And if you see the most of the time frequency, the active management was again the winner. So this means that active management style was more frequently used than the other two styles in general. This is just compare in general. And when I quickly mentioned data analysis before, sorry, I said that I ran a regression analysis because I wanted to know what are the factors that affect the performance of ADLs. And in this case, I included in the analysis cognition, apathy, active management, criticism, and encouragement. And by using this regression analysis, I was going to be able to understand the contribution of each individual factors in the performance of ADLs. So all these variables were included in the statistical model. This is a bit technical, but I'm going to be brief. You don't get bored and I don't get in trouble, I would say. And the model that best explained the changes in ADL performance was made of cognition, apathy, criticism, and encouragement style. And this model explained 40% of the changes in the performance of ADLs. And as you can see here, the only factor that didn't enter the model was active management style. It was the only factor that didn't contribute to the changes in ADL performance in a significant way. So I'm going to explain you what was the contribution of each of the variables to the changes of ADL performance. So for each point that the person with dementia scored on cognition, which means better performance, better cognitive performance, the ADL performance increased by 4%. So better cognition, better ADL performance. For each point that the carer scored on the encouragement, the person with dementia's ADL performance increased by 4%. So the more encouraging the care was, the better the performance of the person with dementia. For each point that the care scored on the criticism style, the person with dementia's ADL performance decreased by 3%. So the more critical the care, the worse the ADL performance. And for each point that the person with dementia scored on the apathy subscale, which means worst level of apathy, the performance decreased by 3%. Apathy, worse performance. This is the contribution of each of these variables. So this was quite quick, but I think we have some thoughts to share now. So I think the main home message for today, and I'm going to be a bit repetitive, but I think it is worth reading this. So first, ADL performance depends on intrinsic and external factors. I think this is the novelty of this study, because yes, we are showing you that cognition affected ADL performance, apathy decreased it, but external factors that are potentially modifiable, which this is the crucial element of these results, they affected ADL performance. And this is doubly important for me because, and as far as I know, this is the first study combining these two intrinsic and external factors, and it's the first showing how the strategies that you as a carer use affect the person with dementia's ADL. So I think this is why it is important and novel, because we can now change and select the strategies and the way that we approach the person with dementia to support their everyday functioning. So I think this is the main message for today, which is quite positive, because we can now know what we need to do. For example, criticism strategies, and we know apathy negatively affects the person with dementia's daily performance. Encouragement strategies and cognition increased it, and active management did not enter the statistical model. So all these four concepts, I want you to keep that in mind, but I'm going to discuss them with you. I'm going to focus first on the management styles. I'm going to give you my thoughts, and I would love to hear yours at the end, please. So starting with the management style, so criticism strategy. So remember that criticism style was the least chosen style among our carers. No, if you remember, the majority of them reporting that they seldom use it. And the criticism style is based on strategies where the carer, for example, blames the person with dementia for having created difficulties, asks the person with dementia to stop doing things that cause worry, use of yelling and threatening. So even though our carers were rarely critical towards the person with dementia, the fact that these strategies still negatively affected ADL performance, for me, shows that a critical environment is definitely not conducive to the task performance of the person with dementia. And you might say, well, this is quite reasonably obvious. If you yell at someone, if you criticize them, if you point at them the errors, mistakes, it's not really good for anyone. But we didn't know this before regarding the ADL performance. So I think this is really important that we can now show this as a fact. And also, on the other hand, if you remember, the use of criticism was found to be associated with increased carers' use of home and social services, I said at the beginning. So there is a connection here. This supports the findings that, for example, the use of criticism strategies leads to poor ADL performance, and this results in the need for greater external help. So it seems that all is related. But the most important thing is that being critical doesn't support ADL performance in people with dementia. And on the other hand, the use of encouragement style increased ADL performance. So encouragement strategies are based on an emotional support approach, which is quite the opposite than the criticism style we think about it. They include ways of encouraging the person with dementia to have a positive attitude in relation to their circumstances, such as, for example, motivating the person to discuss their emotions and feelings, showing the person physical affection, and prompting them to keep up with friends. So the fact that the more encouraging the carer was, improved ADL performance, suggests that from my thinking is that a positive atmosphere where the person with dementia is listened and prompted to express themselves provides a more favorable environment that supports ADL performance. And also, if you remember before, encouragement style was also associated with positive care outcomes. So I remember an Asian study that found that the use of encouragement style increased the carer's feelings of gain. So this means that the use of encouragement style not only benefit the person with dementia in their performance of daily tasks, but also improves the well-being of the carer by feeling more positive and having these feelings of gain. So if you are interested about these strategies, I made a list of them, and they are, for example, the carer who discusses feelings and emotions, prompts to keep up with friends, praises the person with dementia, looks on the bright side of things, tries to suggest ideas that the person with dementia might accept and follow through on, reasons with the person with dementia, encouraged to have a fighting attitude and to do as much as possible for him or herself, and shows physical affection. So all of these are strategies that belong to the encouragement style. But in our sample, the majority of our carers identify themselves as adopting strategies that belong to the active management style more frequently. This was the winner in our sample. I don't know if you remember, I said before. So this style is characterized by a dynamic involvement by the carer in relation to the person with dementia's needs. So a carer who uses active management strategies will be the one who is constantly arranging and adapting the environment, stimulating the person with dementia. They will also notice when to do things where the person with dementia is no longer capable of. So although these carers are actively involved in the person with dementia's daily routine, this was the only style that did not contribute to the changes in the way they perform ADLs. And I have two different and contradictory thoughts about this. I have to be honest, I'm going to open my mind to you and see what you think. But on one side, for me, it makes completely sense that this factor has remained outside the statistical model, because carers using this active management style are those who are deeply involved with the person with dementia's daily activities. And for instance, they have an accurate knowledge of the type of support the person with dementia needs. So this overlaps strongly with ADL performance. But my other thought, on the contrary, I was a bit surprised. I have to say, I was a bit surprised with the results, because I was expecting that using active management strategies was going to have an effect on ADL performance, because from my point of view, if we have a carer who is deeply involved in their caring role, I saw that the use of these strategies was going to lead to an over-assisting role for the carer. So I saw that by over-assisting the person with dementia, they might going to be affecting the way they perform activities. At the moment, it doesn't seem to be the case. I don't have any proof to say this, but I do think I need to explore this further, and I expect to be able to clarify these points with my next studies. I'm going to assess the person with dementia doing real activities, and I am observing the carer and the person with dementia together performing an ADL. So I think I will have more information, and I think this is all about the PhD, to have all these components together and trying to understand more in the context of the ADL performance. And going into a final finding about intrinsic factors. So these findings about increased level of apathy that had a detrimental effect on ADL performance, and that better cognition increased task performance. These agree to previous research, though. This is not new, but this come to confirm previous research in these intrinsic dementia factors. But as I think, as I said before, the novelty of our findings is the fact that we include all these different factors together in the same model. And very important implication that comes up that is based on these intrinsic factors and the external factors together is that there is a clearly need to develop multi-component care-based interventions that address both the intrinsic factors and the external ones together to support the person with dementia in the performance of daily tasks. And a clinical implication, I think, from my point of view, really, really important, is that the use of different care styles contributed to the performance of daily tasks in people with dementia. Specifically, we can now suggest carers to use strategies belonging to the encouragement style when supporting people with dementia. This is not only going to improve the person with dementia's performance of daily tasks, but it's also going to have an impact, a positive impact in their own well-being. So I think this is all for today. And I didn't want to spend a couple of minutes to say a couple of thank you first to my participants and their families. I think that's, I was really lucky and really grateful to have met you, and thank you very much for having participated so far in the research. Thanks to the Faculty of Medicine and Health Sciences for having granted my PhD studentship. To Professor Miyoshi, a big and forever thank you. I think she's the head of all of these factors coming all together. I think she's been doing a lot of research in dementia care for the last couple of years. And thanks to her, we are now going into these strategies and how this contribute to ADL performance. So thank you, Eneida. Dr. Kishita, who is my secondary supervisor, she's always very detailed and really looking into things that I haven't looked before, so I'm super thankful to her. Dr. Kondoker, who helps me with the statistical models and all of that, which is quite complicated, but we have him there, so thank you. Martin, of course, and the task team, which has done a great job the last 4 or 5 years now, going everywhere to visit participants and help with our research as well. So thank you very much to all of them. Well, thank you, and I'm here to discuss these results.
Excellent. Thank you so much, Juli. That was a fantastic presentation. I really loved it, and I understand much better now. If you could stop sharing the screen, then we can see all the people and can see if anybody has any questions yet. In the chat, we have so far only one comment, which is, are the slides going to be shared? I'm not sure you're happy to share the slides, Juli.
Oh, yes, of course. I don't mind, yeah.
Great, fantastic. So if you maybe, once Sam puts again the email address in the chat, if you're interested in wanting the slides, email, and then we can send you the slides. I don't know, do we have any questions? I can kick us off, I guess, with one question, because I thought it was really interesting. So did you look as well across the moderate and the severe stages, if there were differences between the management styles?
No, how I missed that.
No, don't worry. No,
it's a really good point. Definitely. I think, I think this was like a really general idea that we wanted to explore with Eneida. And I think now that we found, these really important findings about the use of strategies, now we need to go further into specific details and to explore more. I was, you know, when I was doing the presentation and writing my manuscript, I was thinking, oh, I need to explore the use of this strategy or the other and how this combines with, you know, because we need practical things to contribute to our knowledge and to help carers who are working daily with people with dementia. So, but I think that's really a good question, and I really missed it. So I think that's...
No, don't worry, you have plenty of time to do it.
Yes, definitely. Yeah.
I think that's really interesting. So feel free to type any questions into the box, or come, you know, switch on your microphone and ask a question in person. If nobody asks in the meantime, I have another one for you, Juli.
Okay.
So I wondered the percentage that people said they were, you know, critical or active or encouragement. I guess this must change over time, all the time. If I think about myself, talking to my children, you know, sometimes I'm critical, sometimes I'm encouraging, sometimes I'm active. Did you check what percentage of time people use this?
Yeah, no, unfortunately, no, I cannot. I think we need to take this as a general approach in our daily routine when we live with someone with dementia and what we do daily. And I think, you know, for me, thinking about the results, it was really difficult because, you know, our carers were not critical at all, but this still affected ADL performance. So it's more about, I think it's a general attitude rather than how much of the time I am using this strategy. I think, you know, maybe in future we could measure how much we use, but, you know, thinking in the way from a carer point of view, I don't think as a carer, I wouldn't be able to say how much of the time I use this. So no, but, you know, never say never.
No, that's great.
Yeah.
I think, so we have a question from Russell Simpson. He asked, if a carer overcares, in quotation marks, or completes the tasks for a person with dementia, although your study doesn't show this effect in the person with dementia, does this hasten the deterioration in cognition or apathy?
Oh, that's a very good question. So I am reading it. So your slide doesn't show.
I think if you're taking over too many things in a way, does it hasten the deterioration? Is that correct, Russell, if I understand it? Yeah.
You know, when I said before that, what asked me, what should I say, more frequently asked question. How much do I need to do? I am overtaking, I need to prompt. How do I support without, you know, over assisting? I don't think I can answer this now with my results, but as I said before, I am looking at how the carer cooperates or support the person with dementia in a real task. So I think by the end of the year, hopefully when I finish the PhD, I will be able to say with carers tend to over assist or carers to not over assist, and how much of this over assistance can affect and how much of them it is related to cognition and apathy of the person with dementia. Yeah, I don't know if I answered.
Yeah, great question. So we have another question from Bridget Penhale, which is a question arises about how best to change the management style that a carer has. What do you think?
Yes. I think, you know, I think we need to start thinking about, you know, we are working on the development of a care program with ENEIDA, so as part of the task project. So I think, you know, the implementing of these strategies are going to be a big topic of our program, because it's not easy to tell someone, oh, you need to change this or this way, you know. But I think, you know, with time, you know, we are learning all the time. Carers are, you know, seeking and looking for information. So I think we need to say, okay, these are the strategies. We need to praise the person with dementia. We need to reason with them. We need to prompt them to discuss feeling. We need to let them do as much as they can do for themselves. That's one of the strategies. I think, you know, slowly we can tell the carer that, you know, one day and the other they can do and implement these strategies. I think it's education, really.
Yeah. Well, that's a very difficult but very good question. So Sue Vaughan is asking, did you find any effects from carer depression? And did this have any effect on the carer's assessment of the person with dementia's ability to perform the activities of daily living?
Okay, that's my next study, but I didn't look at any effect of the depression. I just wanted to know how my carers were feeling, but I didn't include it in this model. But in the next study, I am looking at how depression also affects the carer's perception of how well the person with dementia can do an activity. So that's going to be my next one. I'm sorry, I cannot give you an answer now, but I'm looking into that.
Yeah, that's a really important question again. Another question from Alison Rowe. Is there any difference to the impact of styles if it was a family carer compared to a paid carer, either in the community or in a care home? I guess this is not in the research as yet. I guess that you have you looked at this?
Alison, yeah, I didn't look at this, but because I don't have paid carers in our research, we are looking for unpaid carers or family carers. But there is a study, so if you email me, I can send it to you, that looked at paid carers in the past. I don't remember the main outcomes, but they did find it difficult to measure the strategies because they thought that carers might not be able to say, oh, how critical I am with my patients, because it's quite, difficult to assess criticism if you are a paid carer. But there is one research. I don't remember the outcome, but I can share it with you.
Yeah, I should mention in this context also there's Tamra, who's a research fellow in our wider group, and she does a lot of work in the care homes and the paid carers and looks at this. So hopefully we can have a look at her research in the future, looking at paid versus unpaid carers. A very important question.
Yeah.
Right, then we have a question from Helen. Please, can I ask whether people expressing a management style purely self-selecting? I was just thinking that people may be less likely to admit to a critical style because the critical style would be less likely to be socially acceptable, and yelling and threatening is actually abusive behavior.
Yes, I know, Helen. We had this discussion before with my colleagues. So it is a self-complete questionnaire, so they need to say how frequently they use each strategy. And I think, yeah, I don't think someone wouldn't say that they are being rude to the person with dementia because they think socially is unacceptable. I think that sometimes some carers might be a bit critical without realizing it, without knowing this, and without meaning to, be rude with the person with dementia. So I think it is a difficult area of how to approach this. But I think I am observing carers and the person with dementia, and I didn't see any of these behaviors in my participants. But I think you are right. It is difficult to admit this. However, as I said before, even though my participants were rarely critical, this still affected the performance. So even though we might admit doing one thing or the other, sometimes or often, seldomly, but this still affects the performance. So I think we know now for sure, we don't need to wait for someone to be aggressive to know that this is going to affect the person with dementia.
Yeah. Next question is from Anne Richardson. So I have previously been told not to say you can do this when a person with dementia doesn't believe they can. Does the encouragement need to be more subtle? Oops, are you still there, Juli?
I don't know if my connection is a bit unstable at the moment, but I read the question. Can you hear me, Michael?
Yeah, I can hear you now again.
Yes, okay, lovely. So the encouragement needs to be subtle. Do you mean that you can do this in a positive way? You can do this. Does the encouragement need to be more subtle? I think, from the results from my study, I cannot answer the question, but from my experience, depends on how you tell the person with dementia you can do this. Sometimes the criticism or the way we express might come from the tone of our voice rather than what we say. So I think what I would say is that we need to be very careful on the way we speak and on the tone used rather than what we are actually telling the person with dementia. if the person with dementia doesn't believe they can do something, but you know they can do, sometimes instead of saying you can do this, you can just show them without saying, I don't know, instead of you can make a cup of tea, you can just say, let's prepare tea together and start the activity with, you know, another approach. That's what I would do.
Yes, I think that's a great question, isn't it? Very difficult. Next, we have a point from Dave. I find humor helps enormously with both of us being able to laugh at ourselves when things go a bit wrong.
Yeah, hi Dave.
Did you look at humor, Holly?
Yeah, no, I didn't. Hi Dave, nice to see you. I didn't look at humor, but I do agree with him that, you know, sometimes, you know, situations, humor helps. You know, it doesn't need to be that you are living with someone with dementia. So I think it's a good, yeah, and I'm not sure about what is the research about humor and strength or factor to start looking at. Yeah.
Great, and then we have from Stacey a question, which thank you for the presentation. And I remember working with you when you first began the task. I support unpaid family carers at Carers Matter Norfolk and carry out statutory carers assessment for Norfolk County Council. I would like to ask if there is a plan of how to use this information when it has been all collated to assist in improving carers' lives.
Yeah, I'm not sure if Eneida is in the audience today.
Yeah, Julia,
is she around?
did you answer this one?
Yeah.
Hi,
Yes,
Stacey.
yes, I think so. Yeah.
Thank you, Julia. So thank you, Stacey. And others, yes, we definitely want to move to the next stage. So Julia's PhD and other parts of the project is to identify what ingredients we need to put on an intervention. And then that's what Julia mentioned, we're developing the intervention now based on the results, including her PhD. After that, then we can do trials to test whether the intervention is working. So that's where first we need to know which ingredients are essential to the intervention before we can then deliver it. But it is on the plans, and if you stay around also at the forum, we will make sure that you know when it's the phase of testing it so that we can make sure people can use the results of the research.
Great.
Thank you.
So yeah, more to come basically. It's all happening, which is very exciting to see. I saw that Bridget had another comment that again, people might be not admit to being critical, yeah, especially as there might be allegations of abuse or safeguarding issues. Yeah, it's this kind of question, isn't it? Which is really interesting, I think, to see whether people would admit to being critical or not.
It is. Yeah. I know, but I think the important thing is that we can say or transmit the message that criticism doesn't help. So
yeah, that's the bottom line, isn't it? In a way, yes. So, and then we have just a comment from Kelly, which is Friend Indeed, which is a Norfolk-based charity where they use intergenerational charities, and they just say that it's great work on the study, and that if you want to look at their work, where they're looking using maybe babies and people with dementia. Just wanted to highlight that. And I think that's it in terms of questions. Lots of thank yous and congratulations, and people are very interested. I was myself very interested, so that's really great. I have to change my care management style with my children now.
We all need to.
We all need to, I guess. We all could do better, couldn't we? So if there are no further questions, Sam, could you put again the email address in the chat, please, just for people to have it? And so if you want to note it down, if you have anything else you want to contact us about, and then you're free to go. And thank you to Julie again. Oh, and yeah, sorry.
There's also the feedback form, Michael.
Sorry, yes, the feedback form. Thank you very much. Yes, we have a feedback form. Sam, are you sending this now? Sorry.
Yep.
So there is a feedback form in the chat. If you click on that, just so that we know if you what you think about this series. Yeah, there it is. It just popped up. We would be very grateful if you can complete that. And after that, we hope to see you soon again. I just show you the next actually talk we're having. Just a second.
Thank you, everybody for being there. And can I ask Sam something? Because I've seen that people have sent their emails for the presentation. Will you send me these emails, or how can I get them?
No, yeah, I'll send them to you.
Ah, lovely. Thank you. Thanks. Sorry to interrupt you, Michael.
No, it's all good. So just to highlight, our next open forum will be Thursday, the 24th of June at 2 p.m. again on Zoom. And we're having Keir Young, who's an Alzheimer's Society Fellow from University College London, and he will talk more about changes in perception, spatial awareness in dementia, and what does it mean, where does it come from, and what implications does it have for support, so more the visual changes we see sometimes in dementia. And Keir is a specialist in this, so we hope you can join us again for that. And don't forget to fill out the feedback form, and we hope to see you in June. Thank you.